So we're going to look at autoimmune diseases, transplant rejections, and immunodeficiencies. Autoimmune diseases occur when the immune system loses self-tolerance. So the immune system decides that a body part is foreign and it starts attacking your own cells. All autoimmune diseases are hypersensitivity reactions, so they're either classified as type 2, type 3, or type 4. There's lots of different predisposing risk factors for getting an autoimmune disease, and we usually can't pinpoint the exact cause in an individual. So some of the risk factors include genetic predisposition. There are certain combinations of MHC genes that if you have a particular genotype, you're much more likely to get an autoimmune disease than someone else. So we do see autoimmune diseases running in families. Another predisposing cause would be gender. So out of patients with autoimmune diseases, 75% are women. So that's a big contributing factor, would be the sex of the person. We're not sure exactly why that is, but we do see some differences in how the immune system works in women versus men. Women tend to have a stronger immune response than men do, and they've found a lot more genes that are related to immune function turned on in women than that are turned on in men, so that might be the cause of that. An infection could trigger an autoimmune disease as well. So for example, strep throat can lead to rheumatic fever. So in fighting off the strep bacteria, there's a protein on the surface of the strep bacteria called the M protein that we talked a little bit about before, and that M protein looks very similar to the proteins on the heart valve. So in fighting off the bacteria, the immune cells also will attack the heart valves, and that damages the heart valve, and then you end up with rheumatic fever. And then aging is another predisposing factor. We tend to see more autoimmune diseases middle-aged and older. There's lots of different autoimmune diseases. These are just a few. And some of these we've already actually talked about. So we talked about, for example, rheumatoid arthritis and systemic lupus erythematosus. So remember, those are both type 3 hypersensitivity reactions where the immune complexes get lodged in the blood vessels and other places in the body and can cause damage. So here's just some other autoimmune diseases. Graves' disease, which is hyperthyroidism. Myasthenia gravis, where the immune system attacks the receptors on the skeletal muscle cells, so then you don't respond to the neurotransmitter as well, and then the muscles don't contract and they become paralyzed. And then rheumatoid arthritis, type 3 hypersensitivity reaction, and then here's multiple sclerosis, where the myelin sheath is attacked. And that's a type 4 hypersensitivity reaction with the T lymphocytes that are attacking the myelin sheath. Let's take a look at organ transplants, because transplant rejections are another type of hypersensitivity reaction. There's different types of transplants that can be done. An autograft, auto meaning self, that just means that you're going to be transplanting tissue from one area of your body to another area of your body. So you're just using tissue from yourself and just moving it around. A good example of this would be a skin graft. So maybe you had a burn on your back. They could take, maybe some skin from your leg and then cover up that burn area on your back. An isograft, iso meaning the same or equal. An isograft is when you get an organ transplant from your identical twin. So that doesn't happen very often because not too many people have an identical twin. But with both autografts and isografts, we don't have to worry about transplant rejections, and that's because they have the same MHC ID tags, so you don't have to worry about the tissue being rejected. An allograft is most commonly done. So allo meaning other, this just means that you're getting an organ from another person who's not your identical twin. So we try to match people as closely as we can with their MHC proteins, and that decreases the chance that they'll get a severe transplant rejection. So that's why we try to do the matching before the transplant. A xenograft, xeno meaning foreign, that means you're getting a transplanted tissue part from another animal. So that would be, for example, the heart valve replacements. Those are actually made from the pericardium of like pigs or cows, and they've actually been treated to remove all of the foreign MHC molecules, so your body actually doesn't react to those. There are a couple of places in the body that are immunologically privileged, and so this is where the immune system will not attack a transplant in these areas because usually the immune cells cannot get in there to do that. So the immunologically privileged sites in the body would be your eyes. So if you have a cornea transplant done, you don't have to match the MHC molecules. You can just get a cornea transplant from any other person and not have to do any matching. And that's because your cornea, that clear part of your eye, has very few blood vessels that can bring white blood cells in there, and so you're not going to get a rejection in the eye. Other places that are immunologically privileged would be the placenta, which is good because you don't want mom to attack the baby. Other places that are immunologically privileged would be the testes and also the brain. But we don't do too many testicular transplants or brain transplants, so don't really see those. So let's take a look at our transplant rejections. Two things happen in a transplant rejection. So the MHC molecules on the donated organ are not going to be exactly the same as the ones that you have on your cells, unless it's from an identical twin. So your helper T cells will recognize those foreign MHC proteins and figure out that, hey, those don't belong here, so let's try to attack those cells and get rid of them. And so the helper T cells will send out cytokines and have the cytotoxic T lymphocytes start destroying the graft, and then also get macrophages involved as well. So the type of hypersensitivity reaction this is, where you're involving your T lymphocytes to kill off the cells, this will be a type 4 hypersensitivity reaction. So transplant rejections are a type 4 hypersensitivity reaction. So this is why we try to match the MHC molecules and the blood type as closely as possible, so we get less of a chance of getting a severe transplant rejection. And then I put a link here to this article on the bottom that's really interesting. There's a lot of research going on as far as how to make organ transplants last, and so we don't get as much rejection. Because right now, if you do get an organ transplant, you have to be on immunosuppressive drugs the rest of your life to prevent the organ from being rejected. The most common type of transplant rejection is host versus graft disease. So the host is just the person that got the donated organ, and the graft is the donated organ. So because the transplanted organ, maybe we've had a heart transplant, because the MHC molecules are not an exact match, your immune cells will recognize those foreign MHC molecules and say, hey, those ID tags are not exactly right. And so your immune cells will start attacking that donated organ and trying to kill those cells. And so that causes a transplant rejection. So by being on immunosuppressive drugs, we can hopefully prevent that from happening. And then we also have the opposite, which can occur, which is called a graft versus host disease. So this is when the immune cells in the donated tissue reject your cells. So the example here would be a bone marrow transplant. So when you get a bone marrow transplant, you are killing off all of your stem cells in your bone marrow, and then you're going to replace them with stem cells from someone else's bone marrow. So those new white blood cells that come in, that are being made in your bone marrow now, Well, they have different MHC molecules than what your cells do. And so the cells that are in the bone marrow graft start attacking your tissues. So that's graft versus host disease. So people that get a bone marrow transplant also need to be on immunosuppressive drugs the rest of their life as well. And lastly, kind of the other end of the spectrum, we spent a lot of time on hypersensitivity reactions. We had the type 1 through 4, and then we also talked about the autoimmune diseases, which are hypersensitivity reactions, and then also the transplant rejections, which are type 4 hypersensitivity reaction. And now we're at the other end of the spectrum with immunodeficiencies, where the immune system is not working well enough. So there's not enough of a response. So what happens if your immune system is not responding well is that you end up getting sick and getting cancers. So there's two different causes for immunodeficiencies. So we have primary or congenital immunodeficiencies. The word congenital just means you're born with it. So the primary or congenital immunodeficiencies, they result from genetic mutations. So you've inherited those. And then the secondary or acquired immunodeficiencies, those you acquire later in life. So your immune system was working fine, but then something else happened and you end up with the secondary immunodeficiencies. So there's lots of different causes for secondary immunodeficiencies. So it could be from like HIV, certain cancers can suppress the immune system like leukemia. Also immunosuppressive drugs, so maybe the person you're trying to control an autoimmune disease, or maybe they've had an organ transplant. And then also malnutrition would be another one that causes the immune system not to work well. So here's just some examples of some primary and secondary immunodeficiencies. And I do just want to point out one of the primary immunodeficiencies. So this is inherited. And this is called severe combined immunodeficiency disease, or SID. So this is a mutation of genes on the X chromosome. So usually we see this in male children. And both the B and T lymphocyte cells don't develop well. And so they have no humoral or cell-mediated immunity at all. And usually those children do not survive for very long. So I don't know if you've heard about the story of the boy in the bubble. This is David Vetter. He was born with SID, and they knew that he had a good chance of having it because he actually had a brother that was born before him that died of SID. So they knew that this could happen again. So when he was born, they put him in a sterile bubble, and he actually lived there until he died at 12 years of age. The reason that he died was because to treat SID, you can cure this by giving a bone marrow transplant. And so they gave him a bone marrow transplant from his sister, but unfortunately they did not realize that some of the white blood cells in the bone marrow transplant from his sister had Epstein-Barr virus in them, which is a herpes virus, which you never get rid of. It causes those latent infections. And so because his immune system did not work, the Epstein-Barr virus came roaring back to life. And actually, remember, the Epstein-Barr virus can cause cancer. And so it ended up causing what's called Burkitt's lymphoma, which is a cancer of some of the white blood cells. And he died 2 weeks after getting the bone marrow transplant of the cancer. So that was really sad.